Yes, and we are live. Welcome to the Momference, Latham and Lisa. First of all, everyone, this has been such a phenomenal day, and I am so excited to get into this conversation with Lisa and Latham. And let me just pause and say I am fangirling right now because I am a lover and a supporter of women who do the work, continuing to spread awareness, and that's what both of you do. So I'm incredibly excited to talk to you about the work, your thoughts, how Love Delivered came together, and all that stuff. Like, are you all ready? Are you rocking with us?
Ready.
We're
Yes,
ready.
ready. So I know, like, obviously, as a nod to the collaboration, we titled this "Love Delivered." So, which is like super fantastic. There's so many play on words that I thought about. So before I even ask how did you come up with the name "Love Delivered"? Like, what did that mean exactly in terms of what you guys want to do?
Well, the Love Delivered name was a bit of a team effort, and everything that I've always done with Carol's daughter is made with love. I bring love to what I do. I bring love into my work. I bring love into food when I'm cooking food. I know that Latham brings love into her work as a doula instructor and
Yes,
as a doula for moms and birthing people.
yes.
And, we're delivering love in that we're bringing love to you, but we also want you to deliver into love and to love as you deliver. So there are many, many plays on those two words, and which makes them perfect, which is why when someone in the team said, how do you feel about Love Delivered? I think we were all like, oh.
I mean,
There was
that's what
no
it gave me.
debating.
That's what it gave me. I was just like, I mean, even before knowing so much about it, I'm just like, wow, like what is
Yeah.
and what a powerful as well, like delivering love. I mean, so many plays on words right here. So the first question I had for you guys, for you ladies, what is Love Delivered? Like, how did this collaboration come about, and what exactly is it?
So thank you so much, Simona, for having us today, and congrats on the conference. We were jamming in the background with the DJ. It really started with like a text message, really. And as you know, so much of our ideas that we birth into fruition often start as like these nebulous ideas that we think about problem solving.
Yeah.
And Lisa and I are on text, but I should say audio text because she likes to audio text message folks, right? And she's like, what are we going to do together to join forces? Like, let's think about this. And it's been like a year in the making. You are all seeing something that we've been sort of
Oh
nurturing
wow.
over the course of a year, to make sure that we could bring to you all. And really what it is an opportunity for us to bring resources, education, information, and opportunity to our community, to empower people along the birthing continuum, and also to create advocates who will help to enlist themselves and other people in this fight for better maternal health outcomes, and improving of what we see as maternal and fetal outcomes. In this country, we know that Black women are 3 to 4 times more likely to die during childbirth due to childbirth-related causes. And in bigger cities like New York, that goes to 8 to 12 times, which is astronomical, and it's actually something that we shouldn't even accept, right? And so what we hope to do in the partnership is elucidate information, access to resources, and opportunity for people who want to become birth workers, who want to work with doulas along their birth journey, to have that access and understand that this is something that is ancestral. It came from our people, and we can come back to this work to continue on a path towards healing. But if we want to, think about how to move as a generation and a community moving forward, we have to really get birth right. And so I think that's where Lisa and I really conjoin in terms of our vision, is really about like, that this movement for Black lives has to start before birth.
Mhm.
Mm. It caught me off guard. I said, yes, that is exactly it. That is exactly it. Lisa, did you want anything to share to that as well?
No, Latham had definitely covered all of it. The only thing that I would say is this is a topic about which I'm truly passionate, and it is something that I do as an auntie to other people
Right.
when they're going through their birthing process. to be able to do something much more constructive with targets and focus makes it so much more meaningful, but also to be able to do that work with someone that I care about so much, like Latham, it's not even work, you know?
Yeah.
It's purpose, it's passion, and it's like breathing.
Absolutely. And I totally agree with that. When you're passionate about something, it doesn't feel like work. But then when there's like a strong collaboration and vibes, I always say that's how I feel about Nikki and I. You know, even just the fact that we're having a whole conference about motherhood is incredible. And it doesn't feel like work to me. I'm like, I'm having a good time at this conference. So the next question I had for you is, we often talk about, you know, Black maternal health, the health crises. However, can each of you share factors that are actual culprits to increasing the number of this crisis? So I know we hear that all the time, you know, but at least at this point, we should all be knowing that there is a crisis and Black women are 3 times more. But, you know, in terms of what are some of, because I know, and this is also why I love the name Love Delivered, because it takes away the fear, the very real fear, but it takes away the fear of birth at this time, and it actually alludes to, here are some steps, right? Like, you hear those facts and it doesn't have to end there for you. You don't have to be like, I'm never going to deliver, you know? So I think that it's also good to know, what are the actual factors can we identify that's causing this crisis?
Yeah, so I think we could tag team, but I think first, really establishing that, you know, birthing in America is really precarious. Actually, the UN describes birth in the United States as precarious at best, which is like horrifying to hear in a place that's considered the first world, right?
Exactly.
And that means considered developed. This is actually the most dangerous place in the developed world to give birth, but that does not mean that we don't have agency and opportunity to shift our reality and design for better birth outcomes, right? It means that we actually do have to take the power back ourselves, right? Mm-hmm. And so, so what we see is statistically that there are placental disorders, blood disorders. There are right after birth, which is a very critical period where there may be hemorrhaging that happens. Mm-hmm. That shouldn't actually, if you're in medical care, you should be able to survive, but that's a big factor as well. And really in the postpartum period, we see things also too, like pre-eclampsia and eclampsia, right? So pregnancy-induced hypertension, which is really common. It shows up in the second to third trimesters for Black women. One thing that you can do is make sure that you get like these urine strips that you can get on Amazon, and you can check your protein, or you can check your urine for protein. They're like $13. We should be doing this as pregnant people, because there's a lot of things that are imperceptible to your provider that you'll be able to pick up on. When you start to get swelling in your ankles and in your wrists, that's also a sign potentially of preeclampsia. And so this is something that can be managed, but if not managed, can become lethal, right? And in our cases, if we're going into the hospital and we're not being seen in our humanity, we're not being seen as people who actually have medical concerns, or if it seemed like, oh, you're okay, just take some Tylenol, go home, or you're not really in pain, right? We're seen as impervious to pain, right? Then this impacts the type of care that we get because of how we're perceived. Exactly. And there's a notion, right, that we're strong. Like there's a strong Black woman narrative that's actually killing us, right? And so if our providers don't see this as vulnerable and aren't taking into consideration our needs, then sometimes we don't even know what to look for. Right. And so, and I would love for Lisa to chime in with, because she has like also personal stories too about things that, like, you know, she experienced that people, you know, didn't take seriously or didn't take into consideration. And we, by the way, had kids a while ago. Like our kids are like grown. So like we're kind of moving through this, like she said, as aunties, helping people to map for a future. Right. They don't take the pitfall steps that like some of our other friends and family members have.
Exactly. And I don't know if you guys can see the chat where it says stage. A lot of the moms are saying, you know, yes, like they're always telling us to go take something over the counter. They're not listening to us, you know. Right. And I love to even see the support. Mercedes in the chat just said she had to tell her friend that based on some symptoms, it seems like you have preeclampsia. So, but can you share again the urine test? Because I know a lot of people were saying like they didn't know. Is it a specific brand? Like what is it called exactly?
Yeah, so it's just basically like there pH strips that you can get on Amazon, and there's probably like 100 of them in there. And every day you just check your urine, and it checks for certain types of, whether it's protein, certain minerals, but particularly you're looking for protein. And then protein will leak through your urine if you have preeclampsia. That's one of the signs, and it's an early sign. So that's why I like people to be empowered to do that, because if you have to go to a doctor, and guess what, you might not be able to get your appointment. If you think it's an emergency, and Black people on average spend 2 hours in an emergency room waiting for care, when you could just test a strip and say, I actually have protein. I have like actual diagnosis they can bring into you. Like, I'm seeing this myself. And so just like the more tools we have, I think the better.
Absolutely.
Yeah.
Someone actually just shared a link to this.
Oh yeah, please, yes. This is a community, so share
This is a community, absolutely. And even just knowing, like you said, trying to feel empowered, because we're going to the doctor once a month for your checkup until it's the last 4 weeks, and then you're going every week. But at that point, you don't know what you don't know, right? And then if you feel like someone is not taking you serious, I know for me, I'm less likely to even ask, because I'm like, I don't know if you're gonna take me serious, so I'm just not gonna ask. I'm just gonna figure it out. You know what I mean? Like, so I told her. So Lisa, yeah, same thing with you. What else? I know Latham just said you'd experienced some things yourself.
I do have my own personal stories about, how I felt when I was being taken care of in the hospital and things like that. But I think what's more important is part of what we're trying to do with this is to give people information, because we don't have it and we don't know what to ask for. We don't know what help we might need. We're very into what kind of diaper genie am I going to get? Am I going to use cloth? Am I going to use disposable? What's the best baby carrier? Like, that information is available to us, but we're not having conversations about what our birth should be like, what our pregnancy should be like, what issues do we have to look out for. And we rely on the doctor to tell us everything, when there are things that we need to communicate with the doctor as well.
Right.
They don't always ask the questions that they should ask. I personally feel that doulas and midwives are more patient-centric, and they ask different types of questions. So if you have a doula, your doula can help prepare you for your doctor's appointments, give you certain questions that you should ask. I understand about the test strips for protein, because my first pregnancy, I was 33. My second pregnancy, I was 34. And so all of a sudden I was advanced maternal age. So I was treated completely differently. The second time I had to test my own urine every day and keep a log. And if a number, if there's a certain color, a certain number, I had to call into the doctor. But that was never presented as something that would occur during a normal pregnancy. There's just so much information that we're not given. And then you get into a situation that you've never been through before. That's because right. We don't grow up in communities where so-and-so is having a baby and your aunt is the midwife, and maybe you have to go with your aunt because she's watching you after school, which is how things used to be. You had exposure to that process when we had different lives and we had different communities. We don't have exposure now. So we get into this space terrified with no information. And then they tell us, be calm and breathe. You'll be fine. Get through the pain. What? I'm not ready, And
right.
It's a recipe for disaster, and it's not fair.
Absolutely. And I hope you guys can see the chat. Like, the chat is going off. Like, people, you both are inspiring these mamas to share their stories, and I'm seeing a few sad stories too. That's really difficult to hear. So I'm going to go to my next question. So we were just talking about doulas. What are the ideal qualities a mom should look for when looking for a doula?
It's a great question. I think that it really comes back to the individual and what their needs and desires are. Everybody has a different life experience and sort of what they are showing up to pregnancy with.
Right.
And so one of the first things is vibe, right? Like, energy. and really trusting your intuition about what you feel about someone. This also goes with any provider, by the way. And I think that people will, oftentimes let certain providers off the hook for behavior or tone or ways that they're treated.
Yeah.
And by the way, they might be like, oh, I didn't like this person's energy, I'm not going to, work with them, but they'll take it from a provider, right? They'll put up with that kind of, what we consider actually abuse and harm, right? And it's normalized in certain spaces. And so what I want to lift up, because Lisa brought in midwifery, is critically important for us to like wrap our heads around as a community, the uplift of the people who have done the ancestral work of bringing life into this world as midwives. Yeah. Right? Our nation was founded with midwives at the helm birthing the nation. And they were Black grand midwives. The only people birthing people in this country were Black and Indigenous, okay? Right. Who were delivering all the babies. And so we need to remember that that's the legacy we come from, that we need to create better pathways to access to midwifery. And so what that means in a country where there's like 14,000 midwives, 6% of people of color and 2% are Black, it's hard for us to find people who look like us who are doing this work, right? And so we need to actively invest in education for people who want to take the path towards midwifery or doulaship, right? And so folks in your community, so that we can have people in our community that are doing the work, it's important to lift them up, right? So we need to think about what that looks like, in addition to, being able to find a provider, we have to make the space for providers to exist. So I just wanted to put that up. But the questions you want to ask, you want to find out, like how long someone has been practicing, depending on, sort of where you are in terms of like your finances. There's doulas for every aspect of the spectrum financially, including people who work pro bono, right? So if you are someone where it's like, financially I can't, handle this, or it's a burden right now, there are people who work like that. Through the Love Delivered program with Carol Starr and Mama Glow Foundation, there is a grant to support doula support for people who are looking for a doula and that may not be able to afford it. So there are pathways for this type of support. You also want to find out, to see if your value aligned with this person, what type of experiences they've had. Have they dealt with complicated birth before? What hospital systems have they worked in? Have they done, like, where have they worked? Home birth, out of hospital, in birth centers, in hospital. You want to just see like what kind of experience they have. And by the way, it's okay to also work with somebody who's inexperienced, and people, have to get experience at some point.
Somewhere.
Right. And so I think there's a really big sort of barrier, because so much of the orientation in our nation is around credentialing. People who are really skilled and who may have done a ton of births, or who may have been in a lay person's role of assisting births, may not be considered certified, right? So you might have an auntie or a friend who's overqualified to support you, but
she's not certified,
right? So think about like also bringing people in who have the ability to serve you, right? So you do have somebody who has that wisdom and who has that ability to advocate right alongside you. You want that powerful voice in there, regardless of credentialing.
Right. And I think that's a good point, because some hospitals don't allow doulas.
Right? When I had my first child, my best friend was not yet a doula. She's a midwife now. She was not yet a doula. She was a lactation consultant, and she was studying midwifery, but she was very skilled and had given birth to 3 of her children at home. So when she came to the hospital to support me, she was my sister, because that was the only way she was going to be in that room.
Exactly. Yeah. And I think, and again, why I even brought up the fact that like some hospitals don't allow doulas. So instead of a mom deciding, well, this practice doesn't, or this hospital doesn't, so I'm just not going to get an advocate at all. That is an important point to consider. Look around you. Who are those aunties and cousins who can serve in that space, who are also skilled and can support you and advocate for you?
Mm-hmm.
Advocate alongside you. Yeah, advocate alongside.
Alongside
your voice.
Exactly. Advocate for yourself.
I think when we're in that situation, and we may have a birthing partner with us, whether it's dad or not, we tend to think that, you know, oh, this person that I love and who loves me is here and they're going to support me and everything's going to be fine. And that person is valuable and should be in the space, especially if they are parent to the child that's coming into the world. But they may not have been through this process before either. This might be the first time for them as well. They are afraid. They love you. They're afraid for you. They want to ease your pain. They don't know exactly how to do that. So you definitely need that person who's going to be level-headed and calm, who understands the process, who understands the highs and lows, who understands that mom is going to go through moments where she says things that she doesn't mean, and all of that, which your partner may not be able to do. But if someone is there to help, it makes that process easier for everyone.
Absolutely.
And until you're in it and you go through it, you don't realize. Because I said a lot of bizarre things to my husband during labor.
I can imagine that. And also in the moment, if something like crazy or terrible is going on, they're going through their emotions too. So they're not immediately thinking about the play that you both came up with. Oh my, excellent point. So what are the anticipated outcomes of Love Delivered?
For me, it's about advocacy and getting the information out there. Over the next 3 years, we want to sign up 10,000 advocates. We want to give out information to people. We want to talk to people. We want people to recognize that we can be a resource for them. And we want to get more people who are interested in hiring doulas, get them to doulas, and people who are interested in looking at being a doula as a career, help them to find where they can learn to do that.
Got it. Okay. So just for clarity as well, for the mamas watching, you're engaging 10,000 advocates, and when they sign up and say I'm interested, whether they're already a doula, is there a certain program they're going through, or you're assisting by providing them with the information?
We're providing them with information.
Perfect.
Yeah. And so the Mama Glow Foundation is supporting, is the platform that's supporting the education of the doulas who come through the program, right? That come through Mama Glow. So we have a global maternal health company that started in New York, LA, Miami, and Paris. And then in COVID, we're able to accommodate people even more so through the pandemic. And so a lot of those doulas are already ready to go to assist on a Love Delivered campaign. So people can apply to be doulas associated with the program to support. And then Mama Glow trained doulas are the ones who are actually administering the support for the families.
I see some of your doulas actually here. They're like, yeah, I love being a Mama Glow doula. They're shouting it all out. So it's getting done.
Yeah, so Mira and Erica, that's amazing.
Erica is amazing. Erica, we know she's actually worked with the Momference before. Fantastic. So the next question I had is, how do you, and obviously we identified what the culprits are, you know what the issue is, and you know what your anticipated outcomes are. How do you plan to measure that impact of engaging 10,000 advocates in an effort to tackle the growing Black maternal health crisis in this country? Like, how would we measure that at the end of the 3 years?
Yeah, so there's a bunch of ways that we'll do that, but one of the ways I think this effort is starting with 3 years, which is an amazing way for us to sort of lay the foundation, like Lisa said, sort of bring people in and layer the steps. So over the course of that period, the multi-pronged approach, which does start with like getting the advocates in place, right? The people who are going to keep beating the drum of advancing Black maternal health outcomes for the better. Then having the people who are on the ground doing the work there's going to be a conversation, right? And data points that we can capture from families who've actually had the support of doulas, right? And so very, very not intrusive information, but very basic data will be able to put together a white paper and be able to put after the end of 3 years, be able to look at the overarching reach. But I mean, the initial reach that we've had just with like the press release and the social has been in the millions of impressions. So we've already exceeded the goal of like who we want to reach, just even an announcement. But we're not just stopping there. For us, it's really about, you know, how much more impact we can make, how many more lives we can touch, and how many more people we can help uplift. Because if you think about it, you know, this work we have been systemically pushed out of, right? This was a pathway for entrepreneurship and for sustenance of villages, right? And it's been shut away from us. And so we are reclaiming this work. And there are so many people who are even here today within the conference who've reclaimed this work and are doing work as birth workers, as midwives, as doulas, as OBs, and who are committed to this advancement. So we're here to kind of create a nexus, connect everybody also, but and also create pathways to more programming. We've had a couple of, I think, IG Lives. We have a couple of webinars coming up, and those will continue over the courses of the next few years, in addition to live events, which we'll be curating too as things start to open. But the real, to me, when I think about measure, there's a lot of things that count that can't be counted. And I'm thinking about the impact of people's hearts, you know, how they're changed, how they're, and also the experiences that we're able to support that people may not have been able to do financially or otherwise, and how we can continue to have a ripple effect of changing people's lives over time.
I mean, that's fantastic. I just feel like even just getting to the solution, or well, the work to help end this crisis is fantastic. Lisa, did you want to share something?
No, I mean, everything was covered in what Latham was saying. And, you know, that sometimes when I hear the word Black maternal health crisis, when I hear that term, it bothers me because it makes it sound as if something that suddenly happened, like we suddenly are in this crisis and we have to fix it. We do have to fix it, but we're not suddenly here. This is something that is a systemic problem that has gone on for quite some time. What is sudden is that we're discussing it, we're bringing it to the forefront, and we're demanding that it be different.
Absolutely.
And then another assumption that is made is there's an assumption that Black and brown people are of lower socioeconomic status. So these issues revolve around poverty and access to capital and not as nice healthcare systems or hospitals. So someone thinks, well, I'm going to the nice hospital. I have really good medical insurance.
Right.
I should be fine. No, because you're still Black when you show up at the front door. So it's not about the money, and that's not what's needed to fix it. It's a systemic problem, and it is not seeing who is actually in front of you and listening to her. That's where the problem is coming from. So just recognizing that this is an ongoing thing and it's going to take time for us to make it better. It is a crisis, but it didn't just happen yesterday.
Exactly. And one thing I always say that also bothers me, it makes it sound like it's my fault. Like Black women are dying simply because I am Black. I'm like, it's not happening because I am Black. It's happening because you're racist. Like the issue is on you, not on me, you know? So and again, we're finally talking about it. Obviously it's been happening for years, but I love that the work is being done and no one is shutting up about it. Like there's no time soon. It's like every day you're hearing about these crises, but I also love that we're discussing programs like Love Delivered, collaborations that are put in place to end this. So the last question I had for you both, if women don't have access to a doula or a midwife, or choose not to hire one for whatever reasons, what are some tools that pregnant and new moms can have in their arsenal when advocating for themselves. So like you said, Latham, doulas are advocating alongside you, but you have your own voice, and we're not taking the power of your own voice. So if we don't have access to a doula, what does that look like? What are some things that I need to think about when I'm advocating for myself?
Yeah, so I can start, and Lisa can also share, because we have a lot of personal experiences. But one of the things that's critically important for all of us is that we are making consumer choices. A lot of people don't realize that, like, you have rights when you enter into a space, when you enter into the medical system or the medical industrial complex, right? You have certain rights. And what people don't realize too is you also have the right to fire a provider. And so the way that we sort of think about it is that, like, we're like beholden to them rather than the other way around. We pay them. We pay them. They work for us. Our insurance, no matter like what kind of coverage we have, and no matter sort of where you are economically, it doesn't mean that you don't have a right to use the power of your voice to advocate for what you need. So that's number one. If you don't like the situation, there are ways that you can navigate to move out of that situation, choose a different provider, but never feel stuck with somebody because you've made a so-called choice. Part of what consent is the actual ability to choose differently as well. So I might have given consent and I would like to revoke that consent, right? And so another piece too for us to be thinking about when we're moving through the system, we have a very prominent conversation about consent outside of medical spaces, not inside. And a lot of things that people have experienced inside of the system with regards to pregnancy and birth, they can't really articulate because guess what? They were never having conversations. Things were being done to them, right?
Right.
And so you'll ask questions like, yeah, I don't really know, because guess what? Nobody was telling you. They might have told you afterwards, but nobody asked you if it was okay to draw blood, if it was okay to part your legs for a cervical exam, right? Like what's okay. And so people aren't being asked. A lot of things are happening to you and you feel like you have to just relent, right? Or you have to be cooperative, because if you don't cooperate, guess what you're seen as? Non-compliant, angry, difficult, right? All these things. So we try to sometimes go into spaces and see, like, how do I reduce my the sense of, I want to make sure I disarm people, so I have to probably put their emotional needs before my own.
Exactly.
But now I'm trying to like tamper down, make sure I don't seem angry, so I'm just going to be compliant to everything.
Right.
No. So consent is a legal doctrine that states that a medical provider has to provide you with all the information regarding a procedure or treatment prior to administering that procedure or treatment. And the operative word is prior to. So I need to be able to say, yes, you show me the information, and then you can say, okay, yes to that or no. And guess what? I can also have made that decision and then change my mind completely.
Right.
That choice has to be respected. So we have to really normalize informed consent in medical spaces, because what happens if you decide to choose something that maybe a provider thought they were on course to go a different direction with, you're met with sometimes dismissiveness or attitude, or you're told things to like frighten you about your baby or your body. And so we have to be in a space where this is not just inside the actual delivery room, but we're having these conversations straight up throughout our pregnancy.
Right.
So the questions that you want to ask, is there a medical indication for this, right? Like I'm always like, is there a medical reason why you're doing this? Because if there isn't, I want to stick to what we were doing before, right? What are the risks? What are the benefits? What are the alternatives to do here? What if we did nothing at all? What would happen, right? And you need to trust what that God-given intellect, right? Which is that ancestral wisdom, which is your intuition. When it speaks to you, it is so clear and it is so true. And when we don't listen to it, we often feel like we're blaming everything, but it's really we're mad at ourselves because we didn't listen. So I want to remind us that we do have the power. We know our bodies, and we need to listen to that thing that comes up in us and tells us that something is wrong, because that is also powerful information to like help you navigate this journey.
Right.
Yeah.
I love that. And I mean, hopefully we are also, for those who have, are going the provider route, hopefully we have a good relationship so that some of the conversations aren't, intense. Like I'm able to speak freely about what I want. And I think that I love my provider. My doctor, she has delivered all 3 of my babies, and I trust her with my life, and she allows me to ask questions, and she's actually a panel, a speaker on one of the sessions we have next. So this was a fantastic conversation. I'm so happy that the Momference was able to bring this to our moms. The chat is just going so fast, and I'm like, wow, like, lots of information, and they're like, yes, intuition. So the women are receiving this, and we would definitely love to continue to support. So please, like, whatever we can do, because all this work goes beyond one day conference, like it goes, the community building is ongoing. So whatever conversations we can have on our IG live, whatever we can do to bring our moms to you, we would love to continue that conversation so the work is done to reduce the Black maternal health crisis. So thank you so much, Lisa and Latham. It was a pleasure talking to you both.
Thank you.
You as well. Thank you for having us.
This was great.
Yay. So I think the next thing that we are going to do, thank you. Oh, I think, okay, wait, yes, well, I'm still on here. Listen, I'm just like, I thought I'm never the head mom in charge on the day of. They'd be like, no, do. So this was so great, y'all. It is time for sessions. Forgive us, we were running 10 minutes behind, but we will be back on track, and the conference was still in the same. So if you can go ahead and hit sessions, go into your reclaiming my time, reclaiming my birth, or reclaiming my mind, and enjoy yourselves. There will be Mom Squad in there too, reiterating talking points and helping you if you need assistance. So go ahead and move into sessions so we can get the conversations going. Thank you. This was so much fun. I learned so much. Yeah, this was really good. And I love the pH